So he started peeing blood. That's when he saw the seriousness and decided to go to the doctor. The last time I saw him, I already noticed that he seemed tired, even lazy. My mom had seen it as well. We mentioned it to him that he had to go to see a doctor, but he didn't listen. The blood in his urine, though, made him see the urgency. The next day, he saw his doctor, who noticed the same and sent him straight to the hospital. They did some tests. Leukemia, blood cancer. A week after seeing his GP, he had his diagnosis. Good prognosis, they said. A couple of days later, he started his treatment. I spoke to him. He was in good spirits. I wanted to tell him about this guy I just met, but decided to tell him after the weekend. His body didn't like the chemotherapy he received, so the doctors decided to put him in a coma. One after the other organ decided to stop functioning. At the end, the machines couldn't help him alive anymore. Ignoring his symptoms didn't kill him. Cancer also didn't kill my dad. His treatment did. Hi, my name is Sigrid, and after having experienced gaps in the healthcare system, I have become passionate about becoming a part of changing healthcare through technology. Could it have been prevented? I often think about the possibility of having tests available to help clinicians know what treatments a patient should get. Not only because of the diagnosis, but also based on other factors, such as genetics, lifestyles, demographics. If this test would have been available, my dad could have been saved. But back then, that was not an option. But I think in the future will be. However, other stories can be prevented. Hospital errors, ranging from medication mistakes to surgical errors and hospital-associated infections and misdiagnosis, can have serious consequences. Unfortunately, they occur more frequent than we think, prolonging hospital stay, worsening conditions, or even loss of life. 25% of patients in the US have reported these type of mistakes. Misdiagnosis leading to incorrect treatment, delaying proper care. Between 10 and 15% of all clinical decisions regarding diagnosis and treatment are wrong. Healthcare-associated infections can extend hospital stay and even compromise recovery. Surgical mistakes can have life-altering consequences. Imagine you go in for one surgery and come out with another. In Europe, around 4% of all hospital deaths are estimated to have been prevented. Medication errors, for example, the wrong medication or dosage, can cause adverse reactions or complications. But unfortunately, less than 10% of all these medical errors are reported. So let's talk about the healthcare today. Looking at the healthcare system today, there are a lot of challenges. For example, WHO estimates a shortage of 10 million healthcare workers by 2030. That's almost I need to think now, almost 7 years, 8 years, 6 years from now. 63 countries worldwide are facing significant challenges with their healthcare personnel. The shortage strain assisting staff, leading to overwork and potential declines in quality of care. Just think about the strain COVID had on our healthcare systems. How many people did not leave the workforce, even though they were passionate about the work they were doing? The shortfalling of staff also impacts the access to care. So imagine the staff has left. How do you get the care you need? Limited access leads to delayed diagnosis and inadequate treatment. Next to that, you have rising costs. Healthcare spending as percentage of GDP rose from 8% in 1980 to 18% in 2021 in the US. 25% of the national health expenditure comes from admin costs. That is $950 billion yearly. $950 billion. If the US would automate and streamline 30% of its billing and insurance-related processes, it could reduce 30% of its healthcare admin costs. In Europe, healthcare costs have also increased, with 24% in 8 years. Upper middle income Asia Pacific countries experience a 76% increase in per capita spending between 2010 and 2019. Healthcare providers are paid for quantity, not quality, meaning it doesn't matter if you have a successful treatment, if you are free from whatever disease you had, or if you need to come back with infections or whatever. It does not matter as long as you were treated. Next up, people are becoming older and get more chronic diseases. And rising healthcare costs lead to limited access of necessary services and financial strain on patients and healthcare providers. Access to basic healthcare varies significantly around the world. In developed countries, you often see advanced medical technology and equipment, including updated facilities. In contrast, developing countries may lack essential medical infrastructure. The quality of medical education also varies globally, and at the end, it will impact the quality of care. Variations in healthcare practices, medical errors, and lack of standardization in treatments can affect patient outcomes and safety. So my question is digitization the solution? How can we make sure we're set for the future? Is digital healthcare going to save us? There are already a lot of tools out there that's developed, such as telemedicine, remote consultations, digital health records, and data analytics, and digitally sharing data between healthcare providers. So imagine this. Sarah, a middle-aged woman, noticed a cough that wouldn't go away. In the beginning, she thought it was a seasonal allergy. After some weeks, the cough was still there, and she had also started experiencing shortness of breath. Concerned as she was, she decided to consult a doctor. She shared her symptoms with a doctor, who recognized the seriousness and sent her to a specialist in the hospital. Due to postage issues, she didn't get an appointment until a couple of weeks after. When her appointment was finally there, she went through a series of tests, including chest X-ray and a CT scan. After a couple of days, she gets a call from the specialist wanting to set up a new conversation with her. The first results from the X-ray were in. She still needed to wait for the results from the CT scan, though, but they had found a concerning mass in her lung. Sarah goes through further tests, including a biopsy to confirm the diagnosis. Again, this time she needs to wait for 4 days. The results are in. She has lung cancer. Together with a medical team, Sarah discusses her treatment options, including surgery, chemotherapy, radiation therapy, and targeted therapies, such as medication. While overwhelmed with a new diagnosis and all this new information, she needs to make a decision what approach to take. From Sarah first went to the doctor till she started her treatment, it had gone three weeks, more than. Now imagine, Sarah, she noticed this persistent cough, with worsening the shortness of breath. Initially, she dismissed it as a seasonal allergy. Her concerns grew as the symptoms persisted. Worried as she was, she decided to consult a doctor. During her remote consultation, Sarah's doctor and app symptom checker recognized the seriousness of her symptoms. The doctor referred her to a specialist in the hospital. Thanks to the efficiency of AI-driven scheduling systems, Sarah received a specialist appointment within 2 days. At the hospital, Sarah underwent a series of tests, including chest X-ray and CT scan. The diagnostic tools, powered with AI, analyzed the imaging results quickly and accurately. Within a couple of hours, the specialist called her with the preliminary findings from the X-ray and the CT scan, revealing a concerning mass in her lung. The medical team, supported by AI-driven predictive analytics, recommended further tests, including biopsy, for a definitive diagnosis. Although the wait for the biopsy results was nerve-wracking, AI algorithms analyzed the samples efficiently, reducing the wait time to just 2 days. The final diagnosis had arrived. Sarah had lung cancer. With the support of AI-powered personalized treatment planning, Sarah, alongside her medical team, discussed various treatment options, including surgery, chemotherapy, radiation therapy, and targeted therapies. Despite feeling overwhelmed, the decision support system with AI provided Sarah with comprehensive information about each option so that she could make an informed choice about her treatment plan. It took 5 days from when Sarah first went to see her GP till she started her treatment. Where are we today? AI-powered telemedicine can really enable remote consultations. We heard it in the story. And wearable devices equipped with AI capabilities monitor patients' vital signs and health metrics remotely. Using telemedicine expands healthcare access, especially in remote and underserved areas. But it also helps you monitor the patients with chronic disease, improving their quality of life. Imagine also a triage system with AI, and it optimizes how to spend your resources by identifying urgent cases instantly. So make sure that the patient gets timely consultations, especially in emergencies, and enabling overall healthcare accessibility. Secondly, we have the diagnostics. Now, people manually diagnose a lot. You're starting to see a lot of differences and tools coming into the healthcare system where AI is supporting the doctors and the clinicians to make a diagnosis. So imagine with Sarah, she took an X-ray. The AI tool can detect what area of the X-ray they should focus on. Together with the AI, the doctor sets a diagnosis. The AI can set a preliminary diagnosis, but we need the doctor to support it. The thing is, when you have AI helping you with a diagnosis, it can detect subtle changes that the human eye cannot see. It also has a higher accuracy than the human in many cases. But the human also can see stuff the AI cannot detect, so we need them to work together. Most of the diagnostics today are in medical imaging or radiology, but you're starting to see more and more developing other places in other areas as well. Today, a lot of data has been collected in the hospital. It's often unstructured and no goal in mind other than making sure that you're not being sued for lack of treatment. It's difficult to find specific details, the newest diagnosis, or the trends of a patient. And it can be overwhelming to look at this data. But leveraging AI algorithms to go through this big data, identifying patterns, trends, and correlations, transforming raw data into actionable insights for informed decision-making can really take healthcare to the next level. It knows when to intervene, but it can also detect disease outbreaks, allocate resources strategically, and implement preventive measures effectively. These proactive healthcare measures can reduce hospitalizations and healthcare costs while improving overall patient health. In many healthcare facilities, we really rely on manual admin processes. We heard about it in the US that they have $950 billion per year in admin costs. But relying on manual processes leads to inefficiencies, errors, and increased workloads of the staff. I have talked to several doctors who stopped being a doctor because they didn't want to sit behind the computer so much. And so the doctors are spending more time behind the computer, making notes of the patient, scheduling, billing the patient. Not saying that the doctors everywhere do this, But if you can automate this, automate the scheduling, automate the billing processes and the treatment planning, you allow the healthcare professionals to concentrate on patient care, improving efficiency and satisfaction for both the patient and the healthcare professional. While there are a lot of potentials with AI in healthcare, there are also a lot of challenges and gaps. Let's go through them. So regarding affordability, even though in healthcare organization might see the benefits of using AI in their organization, they might not have the budget to implement these solutions straight away, even though it can save them money. Implementing AI technologies requires substantial financial investment in the beginning and skilled professionals. So this really poses a challenge to the resource-limited healthcare settings. So affordability issue can increase healthcare inequalities and limiting access to AI technologies for underserved communities. So we need government incentives, public-private partnerships, and targeted investments to reduce financial burdens, making AI solutions more accessible and affordable. Healthcare systems also use platforms such as EHR systems, so that's the medical record system in the hospital. But there's so many different medical systems in hospitals worldwide. No one standard EHR system is alike, not front end nor the back end. Next to that, there are some international standards for healthcare data exchange, but has been limited implemented globally. Lack of standards makes it difficult to function across different healthcare environments. So imagine you're talking about complex data with both structured and unstructured data, but you need to transfer it to another healthcare operation system. It's not that straightforward. The AI application also needs to understand the different type of data, but also with these different formats. So we need data standardized formats, and we need collaboration between tech developers and healthcare providers to bridge that gap. Did you submit your genetic data to 23andMe? Imagine your personal data being stolen and sold to the black market. Someone unknown has access to your medical history, diagnosis, treatments, and even genetics data. Protecting this sensitive data from unauthorized access is key to maintain patient confidentiality and trust. We need to protect the data, and we need robust encryption and blockchain technology in order to do so. But we also need to adhere to data protection regulations ensuring patient confidentiality. So we've heard a lot about the benefits of AI in healthcare, but what if the healthcare professionals or the decision makers don't see the benefits of AI? Then it will not be adopted. Or they might see the benefits and they might adopt it and implement it, but is it being used? Without full education, either in the adoption process, but also in the education systems, we will not be able to make sure that AI is actually benefiting healthcare providers all across the globe. In many countries, AI applications used for diagnosis and treatment fall under medical device regulations. Obtaining these regulatory approvals involves rigorous testing, validation, and documentation, and it's time-consuming and costly. One of the big reasons why a lot of startups don't make it. But also, they need the regulatory approval before they can even start selling the product. However, the pace of the advancements in AI outstrips the rate of which regulations are formulated and updated. But imagine you've already created your AI algorithm. It has a high accuracy, meaning it's really being able to detect the ones with the disease. and you go through regulatory approval. The time that you've actually gotten your approval, the data you trained your algorithm on has been outdated, meaning that your algorithm is also outdated and the accuracy is reducing. Next to that, whatever software or algorithm you have, you need updates. But these regulatory approvals, if you do have an update, you need to go through regulatory approvals again. So it doesn't work well together. So we need new regulations or updated regulations within AI in healthcare, also software in healthcare, where they include regular updates and continuous monitoring to make sure that it has the a good accuracy and relevance, even though it's gone some time since they got the approval. Bias in training data can lead to biased AI algorithm. So imagine that the data that you're training on is only white men. How can you make sure that that would even fit for the rest of the population in the world? If the historical data represents certain demographic groups, the AI algorithm will be less accurate for underrepresented populations, but it can also have bias and judging towards other populations. We also need to develop AI systems that are transparent and explainable, both to the clinicians, but also to the patients. The clinicians, they need to know and they want to know, why did the algorithm come up with a certain conclusion? Because they need to agree with that before they use it. And that's how you build a trust and help the clinicians make informed judgment. So establishing clear ethical guides are key. We need industry standards and regulatory policies to provide a framework for responsible AI use to make sure that the patient's safety and trust. So imagine you see a mole on your skin. You take a picture of it on your phone. It tells you within seconds that you should check it with a specialist. The app automatically notifies your GP and automatically schedules a time for you with a dermatologist. The dermatologist takes a biopsy and sends it to the lab. Within hours, you've already gotten a diagnosis: skin cancer. You have automatically been scheduled for follow-up of your choice, of course, remote or live. In your app, you can look back to the automated notes and highlight the highlights of the conversation with your dermatologist. You can also see your personalized recommended treatment based on your genetics, based on the type of skin cancer you have. The app helps you track your symptoms, shares new skin images with your doctor, and notifies the doctor when something is off. You even have a dashboard where you can track treatment progress, symptoms, quality of life, and skin lesions over time. The dermatologist adjusts the treatment plan based on the information you provided from your home. You get an automated appointment with the psychologist because they noticed that your quality of life was reducing. The app also finds a local support group for you. The future of healthcare can give a peace of mind to both patients and clinicians. It helps clinicians become more human, using technology to take away the admin burden so they can actually focus on the patients and the reason they went to the healthcare in the first place. My name is Sigrid, and it's been fun telling you about the potential of AI in healthcare. And I'm looking forward to hearing your questions. You're free to connect with me on LinkedIn or send me an email. Thank you.